On August 16th, President Joe Biden signed the Inflation Reduction Act of 2022 into law. It's a climate, tax, and healthcare law. It passed the U.S. Senate on August 7th and the U.S. House of Representatives on August 12th before going to the president for his signature. And now the focus is on implementing the law. Some pieces go into effect right away, while others won't take effect for several years. Overall, the Inflation Reduction Act uses federal subsidies to reduce the cost of both health insurance and prescription drugs. In fact, for the first time ever, the law provides authority to the U.S. Department of Health and Human Services Secretary to negotiate directly with pharmaceutical manufacturers on the price of prescription drugs sold to the Medicare program. Here's more on those ACA subsidies, and then we'll look more at the Medicare changes. The law extends the increased federal premium subsidies for 3 years for people who buy private health insurance on the Affordable Care Act's private health insurance marketplace, healthcare.gov. These are the enhanced subsidies that were granted under the American Rescue Plan Act that were set to expire, and now they are extended for 3 more years. On the Medicare side, we're going to look at this by implementation date. There are a number of changes that happen in 2023. The law requires drug companies to pay rebates if the prices rise faster than inflation for the Medicare-covered drugs. Also, the law caps insulin copays at $35 a month for Medicare Part D. It eliminates cost sharing for adult vaccines covered by Medicare Part D, and it improves access to vaccines in both Medicaid and the Children's Health Insurance Program. In 2024, being implemented under this law is the elimination of a 5% coinsurance for Part D catastrophic coverage and an expansion of the income eligibility for full benefits for Part D low-income subsidies up to 150% of the federal poverty level. In 2025 is when that $2,000 annual cap on the amount of money that any senior pays for drugs takes effect. And finally, in 2026 through 2029, that's where the Medicare negotiated drug prices comes in. The negotiations actually start in 2023, and then the effective prices based on the drugs selected each year will take effect from 2026 through 2029. In a statement, the White House said the Inflation Reduction Act will lower costs for families, combat the climate crisis, reduce the deficit, and finally ask the largest corporations to pay their fair share. And the statement continues, President Biden and congressional Democrats have worked together to deliver a historic legislative achievement that defeats special interests, delivers for American families, and grows the economy from the bottom up and middle out. You can read more on the Inflation Reduction Act of 2022. We link to it in the description below, along with more on that implementation timeline.